Hi everyone, and welcome back to our special episode on stopping polio before it starts. Today we are talking about the most important part of the fight, prevention.
So, joining us with today, Professor Faseeha Noordeen, who's been working on medical important viruses and also viral infections for years. And Professor, it's great to have you with us today.
Thank you for having me.
Madam, before we begin, why is prevention such a big force when it comes to polio?
Any infectious disease, the prevention is the most important step in control. When you think about polio is a vaccine preventable disease. So therefore, when you have an effective vaccine, prevention is really easy. Only thing is we have to make sure that people susceptible to polio are vaccinated so that we can control polio by vaccination.
So, Doctor, what's the key method of preventing polio today?
Polio at this stage of the control is almost eradicated from the globe, apart from only a few unsettled areas of the world. And the prevention and the control to eradication point was possible through the vaccination. So the polio vaccination started following polio outbreaks, that is several decades before. So that the polio vaccination started with live attenuated vaccine, which is giving a less virulent form of polio virus live to people so that we can make sure that the people vaccinated are immune. And also there is an indirect way of immunizing others that are missed in the community through these vaccine strains passing in water to those people that have not received the vaccine. So that is why live polio vaccine was introduced. But currently the global state is that, as I told you before, almost all parts of the world, the certification is now done to the elimination point. So therefore, at this point in time, the focus has to be targeting the type of polioviruses that still circulate. Now, there are three types of polioviruses. One is wild type 1, 2, and 3. Now, if you think about the global state, still only the wild type 1 is prevalent in those areas where the control is not as the WHO would have wanted. So therefore, the global state is that now the switch is to inactivate polio vaccine. So therefore, we don't allow any live virus particles that are going from the vaccine. So most of the countries that have got the eradication status are 100% going on inactivated vaccine, that is killed polio virus. Whereas the ones that are taking, in regions where still there is a little bit of polio activity because of the control issue, are going live attenuated polio virus vaccine plus inactivated vaccine. So the switch is now to go for a bivalent live attenuated vaccine and trivalent inactivated vaccine. That is the control vaccination today.
Okay, madam. Could you tell us a bit about how the vaccination schedule works?
So the vaccination schedule is designed to make sure that people vaccinated are immune. So any vaccination schedule, if you take, there is what is called priming. That is, we start the first dose and allow the immunity to develop, and that is true for polio vaccine also. And then comes the second and the third doses, and that is to boost the immune response that is primed in the first vaccination. So therefore, the schedule is designed in such a way, at the end of the course of vaccination, individuals that are vaccinated will become immune, so that they will be having lifelong immunity against polioviruses.
So, what happens if a few people in the community don't get vaccinated?
Good question. So, vaccination covers most of the people. Majority will be covered by the vaccination. I think you also, as school children, will know. Currently, there is a group of people that actually propagate messages against vaccination, not only for polio vaccination, for other vaccinations also. So, therefore, when there is a pocket of people that have not received the vaccine, remain susceptible, then in the case of a virus circulation, they will be susceptible. That is the danger. So therefore, it is important that there is a full coverage for polio until the virus is fully eradicated from the globe. So in case when you have this low level of circulation and there is a pocket of people that are not immune, then there is a chance that the virus can hit susceptible people, and there can be poliomyelitis cases arising from those people that are not immune.
Okay, madam. Some areas struggle with the vaccine hesitancy. How can we encourage them to get vaccinated?
So, vaccine hesitancy, that's the thing that I was talking about to you earlier. Vaccine hesitancy is people become hesitant to take vaccine, and that comes from different reasons. First of all, lack of trust in the system. Like people thinking that the vaccine may harm us. And also propagation of messages about the vaccine, so that people have this fear towards vaccine. The third reason will be there are people that don't get vaccine because they don't have vaccine accessibility, right? So therefore, how can we overcome hesitancy is to develop a trustworthy healthcare system that can make people understand the benefits of the vaccine, so that the trust will allow people to take the vaccine without being hesitant. The other thing is to make sure vaccine is available for all. We are fortunate in Sri Lanka, the vaccination program was very successful, and that is why Sri Lanka has now reached the status of elimination. The certification was done in 2016 because we didn't have any polio-like acute flaccid paralysis cases reported in the country since 1994. So therefore, we have reached the status. The struggle is there are spots in the world that are struggling to eliminate the virus. So that there will be a day, I remember teaching students that 2020 was the target point. Then the 2020 came. 2010 was the target point. And then 2020. And now almost we are moving towards 2030. At least I would wish by 2030 the polio virus have gone from the earth, so that we will be having a polio-free world.
So, doctor, are there any side effects or safety concerns about the polio vaccine?
I think if you take any type of vaccine, even for that reason, there is a risk. There is a risk. But if you think about the vaccines undergo many safety trials. So, when a vaccine is available for public use, all the safety data have been received. So when you think about poliovirus vaccine, that's been a long, lived vaccine. So I don't think that anybody has a concern about polio vaccine related side effects. So any type of vaccination, if you take vaccine, there can be mild side effects. And that is inevitable in a way that tells you that you are developing immunity against that vaccine. rather than being a silent person. So therefore, any type of vaccine will give side effects. That is like, people will report symptoms and signs that may mimic the natural disease. So therefore, like, mild side effects are not a big concern for any type of vaccine.
Madam, what can schools and youth groups like us do to help spread awareness?
What can you do as school kids? You talk about vaccines among your groups at home, and read about, authentic information about vaccine, and propagate those messages. First thing. The second thing is to not to listen to messages that are not correct, that are not certified, so that by propagating myths and messages that are not correct, then you create a set of people that develop fear. So therefore, you have to be very cautious in propagating messages that are not accurate about any type of vaccine, so that you can contribute to overcome vaccine hesitancy.
So, Doctor, Sri Lanka has been polio-free for decades, and why is it still important to stay alert?
A very good question. Now, when you think about the world, at times we have unsettled conditions developing. Now, for example, natural disaster, right? And what we went through recently, the pandemic. So whenever such disasters occur, our control programs on other diseases will be, lapsing. Now, say, even in the case of rabies control during the pandemic, the rabies control was not up to date, right? So therefore, any type of vaccination that is happening on schedule can be changed, cannot happen when you have lockdowns and things like that for combating these kind of disasters. Therefore, one has to always make sure that any type of disaster that we may face have a negative impact on the vaccination or any type of health promotion activities that are part of the nation. So the issues that we have to consider is what you call irregularities and disturbances in the ongoing vaccination program by natural disasters or pandemics or war or any type of disasters will have an impact on the ongoing program. Therefore, if you miss those, there can be a risk of getting these diseases that are eliminated to re-emerge. So that is the danger. So therefore, any country that has gone to elimination status has to be on alert because of these reasons.
Finally, what's your message to our listeners about preventing polio?
If you think about Sri Lanka, that we have done well is to continue to do well on vaccination and also adherence to the vaccination. The second point is to Sri Lanka and wider world is to propagate authentic, accurate information about the vaccination so that you help people to stick to vaccination so that we can move towards a polio-free world.
Thank you so much, Doctor, for joining us today.
Thank you very much for having me.